2, and I'm a student from Texas Women's University. Today, I will be inserting a Foley catheter, and this procedure should only take 15 to 20 minutes. But before I start, can I please verify your name and date of birth according to your wristband?
Gwen Winthrop, February 10, 1942. No known drug allergies.
Thank you, Mr. Winthrop. I have now verified with Mr. Winthrop that he does not have any allergies to latex or iodine. I have also verified that this is the correct order from the doctor for the correct patient. Mr. Winthrop, let me explain the procedure to you. So I'm inserting a Foley catheter per your doctor's orders because through a thorough assessment, we noticed that you had some urinary retention. And by inserting a Foley catheter, this should relieve the retention that is inside your bladder, as well as provide clean urine samples for your analysis to send to your doctor. I am now going to don clean gloves. I'm now going to be placing a waterproof pad under the patient's leg. And now with some wipes, I'm going to be cleaning the perineal area as well as drying it. And with each side that I clean and dry, I make sure to use a new wipe each time. Now that I'm done cleaning and drying the perineal area, I will now assess if there are any signs of infection around the perineal area. I have now assessed that there are no signs of infection. I am now going to remove my gloves and start the sterile procedure for a Foley catheter. I will now be starting my sterile procedure to insert a Foley catheter. Here I have placed the sterile Foley catheter kit between the patient's legs. And because this is a sterile environment, I'm going to make sure that I do not contaminate the environment by reaching over or by turning my back on the kit. I will now be putting on my sterile gloves using correct sterile technique. be putting the sterile waterproof barriers over the penis and in between the patient's thighs. I will now be removing the tray with the betadine, the normal saline, and the lubricant. Still making sure that this is on the sterile environment. First, I will open the betadine, the pre-soaked betadine swabs. And put it on the sterile tray. Next, I will open the lubricant to be squeezed onto the tray as well. Next, I am going to remove the catheter with the drainage bag from the other tray, and with the 10mm syringe with normal saline, I'm going to attach it to the port. And now I'm going to remove the plastic from the coil. Now, with my non-dominant hand, which is my left hand, I'm now going to be holding the penis in place, and now I am aware that with my non-dominant hand touching the penis, it is now contaminated and is not sterile anymore. I am now holding the penis with my non-dominant hand. Now I am going to clean the glans penis as well as the meatus with the pre-soaked iodine swabs. And now I am going to dip the Foley catheter in the lubricant. And now I'm going to announce to the patient that I am inserting the Foley catheter. Mr. Winthrop, I will now be inserting the Foley catheter. I have now inserted the catheter all the way to where it reaches the Y letter shaped end. I will now inflate the balloon with the 10mm syringe of normal saline. And now I'm going to remove the 10mm normal saline. And I'm going to gently tug on the catheter to feel some resistance to make sure that the catheter is set in place. Now that I made sure that there is some resistance to the Foley catheter, it is now secured inside the penis. Now that I'm done with this procedure, I'm going to remove my sterile gloves and clean up my sterile environment. And with the drainage bag, I am going to be taping the drainage tube onto the patient's thigh so that way there is no pulling or pressure on the penis. Now that I made sure that the tape is secured on the patient's thigh, I will now make sure that the drainage bag is securely attached to the bed frame. And now that I check that the drainage bag is securely attached to the bed frame, I will now make sure that there's no loops or tangles in the drainage bag, which there is not any, and that the drainage bag is going into the direction of gravity. After finishing the procedure, I will now be performing hand hygiene. And to make sure that the patient is comfortable, I will be using the 5 Ps to check. Mr. Winthrop, thank you for allowing me to insert the Foley catheter. After performing this procedure, I just wanted to check to make sure if you are okay and if you are in any pain. The patient is not experiencing any pain. Because I inserted the Foley catheter, you will now be using the restroom via the Foley catheter. I'm going to make sure that the Foley catheter and drainage tube does not have any twist or tangles or loops, considering this is one of your plugins. And I check to make sure that there is no loops or tangles on the drainage tube. I will now make sure that your personal belongings are within reach, and I will now lower the bed to the lowest position, as well as raise your bedside rails up. I have also placed a call light near you, so that way you can call us if you need anything. Again, Mr. Winthrop, thank you for allowing me to insert the Foley catheter, and I thank you for your time.